Hello, and welcome to the Thyroid Warrior podcast. I'm Ebony, and I'm here as your wellness facilitator. I'm going to be sharing my experiences in managing Hashimoto's disease, and I really hope that it'll help you on your personal journey. Keep in mind, however, this does not substitute as medical advice. It is only for your information and motivational purposes only. Now, let's get started. Hello, everyone. I am very excited for today's episode because I want to really talk about one of the biggest and most important facets or aspects of managing your health as someone that lives with a thyroid condition by discussing a topic called care coordination. And one of the things that I'm really excited about is I now have a digital health journal. I know I've been talking about it for a very long time, but I finally did it. I am working on a print version of that journal. I'm so excited, but you can either head to joyfulebony.com/health-journal, or you can go to SOULA beautyco.com under health and wellness. You will be able to purchase that digital journal as well. And I am so pumped to be able to basically coordinate, so to speak, this conversation with why it's so important to write things down. So what is care coordination? And the basic definition of it is that you are working with your care team, regardless of if it is a primary care physician, a nurse practitioner, an osteopath, anyone on your care team. You're trying to organize all of those activities and making sure that you're sharing the information from those visits across the care continuum. Meaning if you need to go to your primary care, if you need to go to your endocrinologist, if you need to go to physical therapy or acupuncture or any other type of complementary medicine approach, you want to make sure that everyone is working together in order to make sure that your care is basically achieved, or it's coordinated in such a way that it's safe and effective. So when it comes to working on care coordination, what's really important, and I have told you all this many, many times, you want to make sure that you find a care team that listens to you, that understands what your condition is. And even if they may not be a specialist, for example, your primary care may not be the main point of contact in terms of managing your thyroid disease or your autoimmune condition, but you want to make sure that they at least hear you and understand who you are as a person, as a patient, and as a historian, because the historian aspect of who you are helps them to help you. So that is why I have talked about in former podcast episodes why it's so important to write down your questions, to write things down like in my health journal or on a sheet of paper or in a notebook so that you can keep track of what is going on from visit to visit. Now, the other thing that I talked about previously was if you utilize a patient portal, it is also going to be good for you to learn what goes into a patient portal. So I will shed more light on that in another episode because I really want to get in the nitty-gritty of that. But very briefly, that gives you the opportunity to be able to get an overall picture of what's going on with your health. And if you go to the doctor, you can also get something called an after visit summary, which summarizes your visit. It typically gives your vital signs, your medications, who you need to follow up with. If you had a referral, you may actually have the referral built into that report. Some places do it separately. Some places will fax your referral. But anytime that's happening, I always ask for a copy of that. And you always want to make sure that you have your medications e-prescribed to a pharmacy that's close to you and convenient for you. Otherwise, if you know, let's say you're going to travel, you can see where a pharmacy is where you're going, or you can get a paper script so that you can be able to take it wherever you need to go. So that is one aspect of care coordination that is really important to me that I share with you. But the other thing that's really, really important is you're making sure that by working through a care coordination process, you want to streamline it so that you as a patient are receiving the highest quality of care. You, the consumer, are driving your train forward in terms of making sure that your needs as well as your preferences are met, period. And you also want to make sure, especially if you're on any type of medication or biologic, let's say you have different autoimmune conditions, you want to make sure that your doctor is prescribing something that your insurance will cover if you have it. If you're going to the doctor or you're going to a specialist or anyone, you always want to talk about, for example, if you don't have insurance, do they have a sliding scale in terms of how you can make a payment? Do they offer payment plans? With the understanding that you as a patient, you're considered what's called a guarantor. So you're responsible for paying your bill separate from whatever your insurance can cover or not. You want to make sure that given that portion, that is something that's going to be attainable or easy for you to pay. So you always want to make sure you're doing that. And you want to make sure you understand what you're doing, because even when I have spoken with my mom and the health insurance rep, I was constantly trying to make sure that, for example, her medication that she takes for her fibromyalgia would be covered. And we worked out a way to be able to get that medication at a very low cost. That's an example of care coordination between you, the doctor, and the patient, because if she wouldn't have been able to afford that, then we could have looked at other options. And we have also done, for example, you can go to Walmart or Target and there are $4 prescriptions. And what I had my mom do was I said, go ahead and print out that information, take it to your doctor. And if they're trying to prescribe you medications, and let's say there's something you can't afford, ask if you can take any of the medication that's on that list. And I believe GoodRx also has a list of affordable medications that you can utilize as well. So that's another option for you. But the biggest thing too is making sure that everyone understands what's going on. If you're in the hospital and you have to go to your outpatient or the clinic to see your doctor, you want to make sure that transition is seamless. You want to make sure that if you need access to community health services, or if you need food stamps or social services or anything like that, that process is supposed to be streamlined in such a way that you get what you need. And even if you have to follow up with the doctor, let's say you have to come back in 6 to 8 weeks for your labs, all of that information is supposed to be a streamlined process for you. And if you aren't having that, that's when it's really important to basically sit your doc down and say, look, this is what I need to happen for me. I'm trying to include you in that process. How do we work together to make sure that I'm getting my prescriptions in a timely fashion, that I'm not going too long before getting the next dose of my prescription? And I'm harping on prescriptions in this case because I, for a long time, was just getting a 30-day supply of my thyroid medicine. And I'm like, this is dumb. Is there any way for me, A, to get my medication mail ordered so I don't have to go to the pharmacy? And if I do have to go to the pharmacy, can we do a 60 or 90-day prescription? And again, that's something that I ended up doing with my mom as well, to reduce having to go back and forth to the store, which also, depending on when I go, I might be hungry. So I might end up picking up things that I don't need. And that just adds an additional expense that I didn't want. So I say all that to say that is the introduction to care coordination and why it is so important. And I want to direct you to, if you're in the US, the AHRQ.GOV. And that basically gives you a simple overview of what care coordination is and why it's so important. And that way you'll be able to take the power into your own hands to understand what it is. They have different pamphlets and things that you could take a look at. And I'll be doing a YouTube video on this as well, so that you could just have more of an understanding of what it is. They have a toolkit on their website as well that you'll be able to take a look at as well. Even though the toolkit is based upon practices, you still want to understand what those offices need to do, because that gives you the knowledge that you need when, for example, you're like, okay, well, you were supposed to order my referral to go to this doctor and you didn't. Why was that? Did they lose the referral? Were you supposed to fax it? Because in a lot of cases, when dealing with electronic medical records, sometimes the fax just don't go through. The interface doesn't work. And I'm sharing a lot of this background information because, again, I work in healthcare. So I see a lot of this on a day-to-day basis. So I'm pulling back the curtain. This was my promise to you, to actually go into the nitty-gritty and talk more about some of the policies and the background things related to taking care of yourself. And I wanted to share this. So in the next episode, we are going to talk about patient portals and why they're important and how you can really utilize those to your advantage. And until then, I can't wait to talk to you all next week.
Okay, thyroid warriors, get out there and take things one step at a time. Remember, reflect on your triumphs, know that you are doing your best, and do what you need to do in order to be well. I would absolutely love it if you subscribe to this podcast and share this episode with a friend. And don't forget, leave me a review. I read those and try very hard to improve the show based upon your feedback. So I'd love to hear from you. And with that, be happy, be whole, and be well. Take care.